Hi everybody, I just did my last video on the bony anatomy of the shoulder, so that includes the four main joints of the shoulder and how it's a complex, but it's much more intricate than just joints. Around any joint in our body, we usually have muscles, we have tendons that attach those muscles to the bone, we also have ligaments that support the joint itself, we have a nervous system, we have blood flow. We have a lot going on in our body. It's really complex, which is one of the fun parts of my job, that I get to educate people on just how intricate their bodies are. The shoulder, what I want to talk about next, I want to talk about a little bit of the muscle anatomy of the shoulder. If I throw out a word there called the rotator cuff, or a couple of words, the rotator cuff, most people perk up like they've heard that word. Maybe they've heard of someone who has torn their rotator cuff or had a surgery, or they've seen people walking around in those big slings. Well, that is because usually they're dealing with some type of a rotator cuff issue, and in the case where they need a big sling, they had some damage that needed to be surgically repaired. There are all different levels, though, to the amount of damage that can happen there, from a minor strain or irritation to a major issue. But before we get into some of those type of things, I just want to talk about the anatomy. So there are four muscles that make the rotator cuff. Those muscles surround the shoulder. So if this is a shoulder, a skeleton here with the muscles on it, this would be my right shoulder. Well, deep in that shoulder, underneath my shoulder blade, in between my shoulder blade and my chest wall, if you can picture that, we have an important muscle called your subscapularis. It sits here. It's one of the four muscles of your rotator cuff. The other muscles are more so on the back of the shoulder. So if you can think about where your shoulder blade is and where that moves on your wall, on your chest wall, you have muscles that are located there. And those would be your supraspinatus, which runs right over the tip of the shoulder. Then you have a muscle underneath that called your infraspinatus, and it runs more in the meat of the back of your shoulder, on your shoulder blade. And then down below, you have another muscle called your teres minor. Those four muscles make the rotator cuff. Their muscles and their tendons wrap around that ball and socket joint. Essentially, what they do is together, when they act, which is how they often act and work, they hold the ball of your shoulder really nice and snug within the socket. So when there's an issue with one of those muscles or one of those tendons, it means that that shoulder doesn't move quite like it should. The ball doesn't move quite right within the socket. And it's liable to be sensitive with things like reaching, or things like pushing, pulling, carrying, because all of those activities work against some of that ball in the socket, and the rotator cuff needs to hold that ball in the socket at the same time. So those muscle groups are oftentimes irritated with the very same things that they do. Doing more reaching than one is used to, maybe pushing or pulling something heavy. Sometimes it's falling on the shoulder and having a blunt force trauma to that shoulder. Sometimes it's something as simple as making a quick movement that the arm wasn't ready for. But the muscle anatomy of the shoulder goes much further into depth than just the rotator cuff, but I get a lot of questions about what the rotator cuff is, so I thought I'd take some time just to educate you a little bit on that. If you're having issues in that area and you're wondering, is this a rotator cuff issue, I'd be happy to help you out sometime, or I would suggest meeting with a physical therapist where they can help diagnose some of that issue so that you can get the help you need. Thanks.